shoulder internal rotation. So we're gonna use a door jamb here as a anchor point to where we can move through a bunch of different positions to where I can use the door jamb to kind of lock up my arm and then use my trunk and my lower extremity to drive motion in that shoulder complex. So a lot of times people have a hard time establishing internal rotation in like a passive manner, meaning I put you on a table, we go through some stretches, maybe like a sleeper stretch. They have a hard time being able to relax into those positions. So we can use these types of this type of setup to introduce all these different movement variations where we can create combined motions, which kind of mimic more people's day-to-day use anyways. Because very rarely in a joint that's as movable as the shoulder and the hip do we use them in these isolated planes of motion. So this allows us to combine a bunch of different motions into one. So when I get set up, I'm gonna have my left hand on the inside of the door jamb here. And what I'm doing is I'm trying to hold on to the trim. So that way I can kind of drive the motion and not worry about like actively rotating through my shoulder. So the lower my hand is on the wall, the less aggressive it's gonna be in terms of internal rotation. The higher my hand comes up the wall and I'm holding on to the same like part of the trim, meaning my fingers are going on the edge and I'm holding like that. The higher up I come, the more internal rotation that I'm gonna get. So where I like to start is kind of that lower ground. Maybe you come on the wall, come up just a little bit so where you can feel some stretch. And then it's important to know where your frame of reference is for your midline. So my hand is about in the middle of my spine. Because what we'll do is when I start doing like weight shifts right and left, that hand is fixed. So if my hand is fixed and I shift away from it, there's gonna be less of a stretch. If my hand's fixed and I really shift across my body, there's gonna be more of a stretch. So grabbing the trim, coming up to where I feel just a little bit of a stretch, nice and tall. And then it's important to talk about what we're doing with our shoulder. So a lot of times when we're doing this, we'll see people that will really let their entire shoulder complex round forward. So when I'm grabbing the trim, I need to be mindful that I'm depressing that shoulder blade and making sure that my shoulder blade is not tipping all the way forward. It's staying in that neutral position. So then we can work on elongating some structures across the front of the shoulder. And then specifically like our pec minor, because of where it attaches up into the shoulder blade. If I keep that depressed, I can get a little bit of a pec minor stretch as I start transitioning through the motion. So again, a lot here. We'll walk through it as we progress these different movements. So back on the trim, my hands in midline of my body, come up to where I feel a little bit of a stretch. And then what I like to do is just from here, simply lean forward slightly. That's gonna amplify my stretch. And then maybe I just add head turns, left and right. I really double check to make sure that my shoulder blade is depressed. I'm nice and tall. And then what I can do, if none of those bother me, maybe we do that for reps, is I can start adding weight shifts. So I can go left, and I can go right, left, right, then I can go forward, backward, forward, backward. And then we can start adding rotation. So what I'm doing is I'm gonna depress, I'm gonna rotate my torso toward the camera here, and I'm using the door jamb to leverage my forearm so I'm not compensating, and then I can rotate away. And then maybe we start adding a diagonal step and a rotation. So that's where you can be creative. There is no like right or wrong. It's all relative to your symptoms and making sure that we're getting the loading into the correct tissues. Shouldn't be painful. You shouldn't have any sort of like sharp pain sensations, but like a deep tissue stretch is kind of what we're after. And we're just transitioning and trying to combine as many movements as possible to kind of improve your ability to move into, you know, maybe for women, what we're working on being able to take our bra on and off, tucking a shirt in, reaching, grabbing your wallet for guys. It just looks different, right? Washing your back, those types of motions. We're combining different planes of motion to drive more of like that functional internal rotation. So be playful with it, avoid any sort of significant pain. A really deep stretch is normal. You may have to kind of challenge some of your beliefs, meaning is that a pain response or is that more of a stretch response? Because a lot of times this is a different setup for people and they haven't experienced that type of sensation before.